Do not touch your face. I just touched my face. Hi guys, my name is Bethany.
And I'm Melody.
And we are both nurses, and we wanted to give you guys an update on the coronavirus and also ways that you guys can protect yourselves and other people. So first, we're going to talk about flattening the curve, which probably a lot of you guys have heard. And it's basically just so that the hospital and the healthcare system can meet the demand. So right now, if this is the capacity and it peaks above, people won't be able to, there won't be enough supplies and staffing. So by flattening the curve and slowing down the spread, it's going to allow everybody to get the care they need and for there to be enough resources to handle the demand. What can you do? Social distancing is the first thing we'll talk about.
Yeah, social distancing. According to Johns Hopkins University, their website, so it says that social distancing is a public health practice that aims to prevent sick people from coming in close contact with healthy people in order to reduce opportunities for disease transmission. So right now I think they're saying 6 feet apart, and that's actually like a really, really far.
Distance. Yeah.
It
Not
is-
this close.
Yeah.
So social distancing is really important because it's basically a community isolation measure, and it's something that all of us should be responsible for doing. Next, hand hygiene, super important. Your hands are dirty. That's why we recommend very frequent hand washing. 20 seconds with soap and water, and also go between fingers under the nails, especially if you have long nails. It's really important to clean underneath the nails. And don't touch your face, because the last thing you want is to like touch a surface or drink and then touch your face on accident. And it's actually really hard because
really difficult.
Yeah.
Even as healthcare workers, I think it's just very natural for us to, I don't know, touch your hair, touch your face, like all that stuff is very, very hard not to do.
So if soap and water aren't available, and you use hand sanitizer, make sure it contains at least 60% alcohol content.
Try your best to protect yourselves, to follow these recommendations.
If you do feel sick, don't go straight to the hospital. Contact your healthcare provider first, and they'll give you some advice on where to go from there. So there has been an extreme shortage of masks, and specifically for us, N95 masks, which are really, really important to protect us and the patients that we take care of. CDC says you do not need a mask if you are young and healthy going about in the public. Save those masks for people who need them.
I've been working on the floor a couple days in a row already, and
Taking
things
up
have
shifts
been
over
rough.
the weekend.
Yeah, I've been picking up extra shifts just to help out on the floor more because we've been short, and definitely it's crazy because you see that already, at least our unit are short of masks. So we've been very, very careful with, you know, how we're using it and everything, but we're short already.
Yeah. So another thing, some people don't know this, you can't just grab any N95 mask that's available. You need to be fit tested. So just because you see that, oh, there's a certain type of N95 mask available, it might not be your size. Hospitals are also taking measures as policies have been changing. So for our hospital, employees are being screened for temperatures, and also several hospitals have been implementing a no visitor policies with certain exceptions that are listed under the criteria.
Yeah, so for instance, for us, our hospital currently, like what she was saying, for the past few days that I've been working on the floor, policy has been changing on a daily basis, like literally.
Be sure to check CDC and your county's website for new updates because they're changing so frequently. Same thing with like numbers. The reason why we're not like specifying the numbers is because by the time we upload this video, the numbers might change, the policies might have changed. So yeah, just definitely check with your county and check CDC. So most cases of the coronavirus, I think around 80% is mild cases and people have recovered.
So the coronavirus, it really affects especially those who have a weaker immune system and also the elderly. They tend to be more vulnerable to getting the coronavirus. So I think it's everyone's duty, just as a human being, it's just we need to be kind, be thoughtful, mindful of others. Definitely take care of yourself, because if you don't take care of yourself, it's hard to take care of others. But especially in this time, I think we all need to come together as one and really work together. You don't know if you contracted it, and you can pass it on to someone who's elderly, whose immune system may not be as strong.
So it's really important, even if you're young and healthy, keep in mind that you could spread that infection to someone else who isn't young and healthy, and that could have serious consequences. So just be sure to follow these recommendations because it's for everybody's sake and it's our moral responsibility to do so. Don't be selfish. Like we've been seeing with the toilet paper, there are people who have fought for toilet paper, and if you go on social media, you can see that
just being unkind is really not the best way to go about things. I think especially during times of distress and all of this chaos going on, and take care of yourself, but also be mindful of others. Take care of others. Everyone should stay safe.
One thing I wanted to talk about was the racism and xenophobia surrounding this coronavirus, especially towards Asians, people who look East Asian, and it's really awful the things that are happening. People are getting beaten up, spat on, mistreated, and this is the time where we should be coming together. We should be compassionate. Spreading hate, being fearful,
it really does
being
nothing
selfish.
to help.
It's really hurting everybody, and it's never the time to do so. A lot of people are actually not so much scared of the virus, but are actually scared of the food shortages and the racism. Just remember, be kind to one another, be compassionate, especially during this time. Check up on your family and friends, make sure they're doing okay, and
practice good hygiene, basic hygiene.
Be alert, not anxious.
Yes. So definitely check up on like CDC and also whatever your county posts, because things are changing rapidly. As we learn more about what's going on, things can change, so it's good to keep yourself updated through reliable resources.
There's a lot of misinformation out there, and people are retweeting or sharing these posts that might not have accurate information. So double check your sources and make sure that the information that you're receiving is from a credible source. Alright guys, I think that about wraps it up for this video. If you have any more questions, leave them in the comments down below, or another video suggestion. Give this video a thumbs up and subscribe to my channel for more videos, and stay healthy and stay safe. Bye guys.
Bye guys.